Good morning, everybody. Wynn Brown here with our Wednesday, March 18th morning Haywood COVID-19 update for all of you. As promised, I do have a green tie on today. Sorry I didn't have one on yesterday, but as you all know, I'm colorblind and I needed a little wardrobe assistance, so I got that from my oldest daughter last night. So thank you very much for putting up with me not wearing green yesterday. On a more serious note, the update, we've conducted 29 COVID-19 tests on patients. 6 are back negative, so all negative so far. We do have 4 that we are waiting, and hopefully we'll get today, that are over 4 days since the testing's done. So we're just trying to, hopefully that turnaround time will get taken care of today. We have also, interestingly, had no flu A or B overnight. This is probably the first day that we have not had flu diagnosed in our ER overnight. So hopefully that might mean that the influenza is starting to wane in our community. Reminder today too that we went to a single entrance at the Haywood Hospital campus, and that the south lot is actually now available for staff parking, because we really don't have patients parking there. So, which typically is patient parking, is available for staff to park in, and you just need to walk around the building. Given the fact that our life center, our wellness center is closed, you can get some exercise in on your way to the front door. We are making some changes coming up on our Haywood Sign Up Genie app, which is for manning the front doors, because we had that set up for staffing for 2 doors, and now we're down to 1. HR is going to be working at getting the staffing set for that. So stay tuned if you're signed up for future shifts at the door. We're making some changes there because we only have 1 doorway open. Obviously, we went live today with our labor pool, and we'll be working on that over the coming week. So as we rejigger staffing based on volume around the hospital and around the medical group, if your role or assignment change, you can end up in the labor pool. You can also choose to go take ETO or take a day off without pay, depending on what your personal situation is. And so we're working on getting that ready to make sure that when we have openings for staff to work and staff are willing to be flexible, that we can do that. Just a note on supplies. We've been working very hard, Scott and his team, to make sure we have supplies. Just for example, we have 7 days worth of Purell at the moment. Our blood supply is actually normal. I know if you're probably hearing in the news right now a big shortage around Massachusetts and the country around blood, but our currently at this moment in time, our blood supply is normal. Quest is supposedly going online with its testing at its Marlborough location today, so that we have closer access, and we'll be up to 1,700 test kits with that coming online, with having it there, because we can also use our influenza test kits with Quest as well. Critical levels, we're low on regular masks and disposable gowns. We're supposed to get a big shipment of purple tops today, and we're clearly continuing to make sure that we have enough masks and other PPE, which is a challenge for us. Tomorrow, I forgot to put one on, but we have Caring for Colleague pins that are going to go for sale for $5, and they say they have the British theme, keep calm and wash your hands. So those will be fun and out there for our Caring for Colleagues Fund, which obviously is going to get a lot of activity as we move deeper into the pandemic. So if you want to do a payroll deduction or make a gift or a gift of ETO into that, you can do that, and that form is available online on our intranet. So I encourage you to do that. Tomorrow, believe it or not, even though it's beautiful today, we're forecasted to have snow, 1 to 2 inches. So plan your drive accordingly from a time perspective to get to work. Good footwear, because of infection prevention things that we're doing. We will not be running the shuttle tomorrow, so just make sure that you're prepared to enter and leave with snow on the ground. And just finally, Andy Patterson had a nice message to his staff at Haywood Medical Group yesterday. There's a lot of change going on there with the shuffling around of their staff and their clinics. So he closed his memo to his staff with, please remember to wash your hands, support each other, wash your hands, care for yourself and for your families, wash your hands, remain grounded and strong, wash your hands, and always smile. So let's put a smile on our face today. Let's do our best to take care of each other and our patients and our community as we continue our journey to be one of the best community-owned health systems in America. Have a great day.